Now, should you see a health professional after you strain your lower back? Now, I must say, honestly, a lot of lower back strains do get better and progress by themselves, but a lot don't. And there are some things that you need to be aware of so you know when it is critical to reach out for help. Now, the lower back is in an area that it is used in everyday things like standing, sitting, walking. So it is an area that is a lot harder to rehab and get better by yourself compared to the other areas of the body. But the lower back, it is always weight bearing. So typically for the lower back, we see more patients reach out for help for this area compared to the other areas. Especially, number one, if the pain just continues and doesn't go away, or worse, it gets worse after about 3 days. That is when you should really be thinking about ring up your physiotherapist to have a talk about the symptoms and let them help you, guide you to make that decision on whether different therapies should be implemented to help with your recovery. Now, lower back is also an area where there's a lot of nerve structures. The sciatic nerve, the femoral nerve, and the discs are all in that area. A lot more complicated compared to some of the other body parts. So you really have to watch your symptoms and be a bit more careful when it comes to the lower back. In our clinic, we welcome the patients to just ring up and just inquire and ask and talk to the therapist to get their advice and opinion. Now, number two is that if you're getting pain actually radiating down, so nerve type symptoms like tingling, burning, so pain down the leg, like what I said, sciatic, femoral nerve, there's a lot of nerve structures around there that does supply the leg. So if you're feeling the nerves or the leg pain, that means the nerves are involved. So this is something that you might want to speak to someone, your doctor or your physio, about getting some scans done or get yourself assessed to see whether your nerve is injured together with your lower back. Now, number three is that if the symptoms are recurrent, that means you get that recovery and the pain comes back. Then you get that recovery, it comes back again. And that might happen over weeks or months. So if the symptoms are recurrent, that means the underlying cause is not addressed. The pain is just the symptoms on the top that's just on and off. So this is something that you want to talk to a health professional about to get rid of the underlying cause so the symptoms do stop for good. So that's really important. So these are the three biggest things you should be watching out for, and follow for more tips on how to manage your body better and move better.